So this is a collaborating center on viral hepatitis and HIV set up through the WHO Regional Office for Europe. So this is a region that covers 53 countries, so all of Western and Central Europe, but also all of Eastern Europe, including all of the former Soviet Union, which also includes 5 Central Asian countries. So it covers a lot of ground with a lot of countries of very different status, particularly regarding their hepatitis and HIV epidemics. Collaborating Center fits into the series of WHO collaborating centers on all kinds of health issues, and it's based at our center, the Center for Health and Infectious Disease Research, CHIP, at the University Hospital at the University of Copenhagen in Denmark. This is a very convenient collaborating center for WHO Europe because the European office is also in Copenhagen. And what we do is we carry out technical assistance work for the regional office at the request of the national governments. And these are issues related to, for example, an HIV program review, support from the Global Fund, typically for HIV, that goes to, from the governments to WHO to the collaborating center. But also in the field of hepatitis right now, we're carrying out a couple of hepatitis-specific studies related to the first WHO Global Hepatitis Policy Report, where we're carrying out sub-analyses related to hepatitis surveillance, both throughout Europe and another paper specifically on countries in Central and Eastern Europe. So a request comes from the national government to WHO Europe, who then will make a request to us. So we develop a work plan together with them. We plan the year ahead and what kinds of expectations and things we have. So we know of the deadlines for the Global Fund, so we would plan HIV program reviews in advance. We know that WHO Europe is working a lot more on viral hepatitis B and C, so we're starting to plan what can the collaborating center contribute in that regard.
Okay.
So these are 2 main reports. The 2013 WHO was a global report on hepatitis policy. A lot of findings. It follows on the heels of the WHO hepatitis resolutions, and some of the high-level findings were related to the high number of countries that don't have any strategy or any written strategy on hepatitis, the poor surveillance in many countries, the lack of registries, the lack of information on co-infection, the lack of information on liver cancer and liver cancer mortality. So there are around just over 40 questions. We had a response rate of, I think, around 80% in the European region. About 124 member states of WHO, so countries globally responded. Now, when this report was done, the global community said, well, what about us? You ask the governments, and sometimes we agree with them, but a lot of times we don't. We said, well, WHO works with national governments, so through the World Hepatitis Alliance, they commissioned us again to carry out a community response to the WHO Global Hepatitis Policy Report. And there we reached out to over 800 organizations, some hepatitis patient-specific groups, some HIV groups who also deal with hepatitis, and some larger health groups. One of the first findings we found was that many countries simply don't have a patient association. I think the World Hepatitis Alliance only has members from 75 countries globally. And what we found in this study was a very low response rate. About 100 groups responded, and that there was, in many cases, widespread disagreement with what the governments reported to WHO.